Hi everyone, I'm Rebecca Graham, CEO, Women's and Children's. I'd like to begin by acknowledging the Kaurna people, the traditional custodians of the land that I'm standing on here today, and I pay my respects to elders past, present and those emerging, and extend that respect to all First Nations peoples. I would also like to acknowledge the wisdom and contributions of Aboriginal communities across our network, whose knowledge continues to enrich the care that we provide every day. The Friends of the Women's and Children's Hospital are an incredible part of our community, and your impact is felt every single day by patients, by families, and of course by our staff as well. Over the past financial year, your dedication and tireless efforts have resulted in fundraising of more than $1.3 million. Total shop sales have reached almost $1 million at $986,000. And this has been a significant increase from the previous year. And you have donated over $337,000 directly to the Women's and Children's Health Network, supporting the vital equipment, services and sometimes passion projects, including those at the Child and Family Health Services CAFs, and across their sites, in fact across the state, of which of course has a very large country footprint. This is just incredible. These achievements are powered by you. 497 members, volunteers and supporters who give their time, energy and heart to make a difference. And I hear that many of your 22 auxiliary groups have been operating for around 60 years, and your shops will celebrate 100 years of service in 2027. This truly is a shining example of your community spirit and commitment. We are truly thankful for everything you bring to our network. Your support helps us to deliver the highest quality care that is also compassionate, inclusive and deeply connected to the needs of our families. You are part of our story, and your generosity continues to shape the future of care across our network and beyond. On behalf of the Women's and Children's Health Network Governing Board, our executive team and all of our staff, you have our heartfelt thanks. Thank you for your legacy, your belief in what we do, and of course your support. We are proud to walk alongside you, and we look forward to continuing this journey together as we make plans for the new and very exciting Women's and Children's Hospital. Your care, commitment and community spirit are woven into the very fabric of this organisation, and I see evidence of that all the time. Thank you very much.
Hi, I'm Stephanie. I'm one of the paediatric audiologists with the Women's and Children's Health Network Children's Audiology Service. And I work across the Women's and Children's Hospital as well as a number of community sites around the state. We were very lucky to receive 3 brand new Grayson Stadler AudioStar Pro audiometers. The benefit of these audiometers is that we can have access to a digital display of results, which allows us to directly import these onto the computer. This has been awesome for, counselling and showing patients and children their audiology results, and they can see their picture on the screen, but also in terms of productivity, being able to directly put results onto the patient's medical record instead of having to handwrite these and scan them onto the computer. So on behalf of our team, we want to say a massive thank you to the shop's volunteers and foundation members for this very generous donation of this equipment that's allowed us to provide a high quality, efficient service to our consumers. So thank you so much.
Hi, my name is Liz and I'm a theatre nurse in Rogerson Theatre. I'm here to receive the chondrotome and handpieces that have been donated by the Friends. We use this instrumentation in orthopaedic arthroscopy surgery, and the latest technology is a real asset to our surgeons as they're performing this surgery. I would like to thank the auxiliary members throughout the state for all of their hard work in fundraising for the hospital, and I'm really pleased to be receiving this on behalf of my colleagues. So thank you for all your hard work.
Hello, I'm Jamie and I'm a registered nurse who works in the Rogerson Theatre in the Women's and Children's Hospital. We are fortunate enough to have this Medtronic nerve monitor donated to us. It helps us to locate the nerve, monitor nerve function, and prevent nerve injuries in the head, neck, and spine surgeries. A big thank you to our Friends members and the many shop volunteers who made this purchase possible. We're deeply grateful to you. Thank you.
Hi, my name's Kirsty. I'm one of the Associate Midwifery Unit Managers of the Delivery Suite and High Dependency Unit here. We care for women in labour or women who have some extra needs and need to be admitted to the High Dependency Unit, and we've been very lucky to have been donated by the Queen Vic Women's Auxiliary 5 of these TENS units. They assist women with pain management. They're very non-invasive. They can be utilised with other adjuncts, other therapies. We're very, very grateful. They've been used every day since we've received them, and they're excellent. Thank you so very much.
Hello, my name is Amy Onley and I'm the Equipment Nurse Consultant for Neonatal Services. It is my privilege to thank the Friends of the Women's and Children's Hospital for their ongoing support and generous donation. We were lucky enough to receive funding to purchase a new Servo-N neonatal ventilator and GE Giraffe shuttle. The Servo-N neonatal ventilator is an extremely advanced neonatal ventilator that we use to deliver non-invasive support to vulnerable neonates. This mode of ventilation captures the electrical activity of the neonate's diaphragm and adjusts the ventilation accordingly. It is a very gentle and synchronised mode of respiratory support that we know has significant benefits for the neonates, particularly for their fragile lungs. The GE Giraffe transport device is a portable transport unit that enables us to deliver continuous, humidified respiratory support to neonates being transferred between different areas of our hospital. In the near future, we're hoping to enable the shuttle to seamlessly transfer babies from theatre or delivery to our neonatal unit, minimising intervention and disruption for the neonate during this particularly critical period. Once again, on behalf of our team, our neonates and their families, a heartfelt thank you to the Friends and the shop volunteers for their ongoing support and generous donation. Thank you.